Good afternoon, and thank you to each and every one of you for being here with us today. We want to welcome you to the 7th Annual Roseman University Research Symposium. I am Claudia Freitas, one of the co-chairs for the Research Symposium this year. Before we start, we really want to remind you to please refer to the symposium website if you have any questions in regards to the program today. For your convenience, we are placing the link for the website on the chat box. Now, I'm quickly going to share my screen so I can briefly guide you through that site. Give me here just a second. When you get to our website, I invite you to scroll down and you will find a couple of tabs. The ones that we really want to encourage you to use are the symposium schedule and the e-poster gallery. On the symposium schedule, as you can see, you will find the different Zoom links and times for each one of the sessions. I want to bring your attention to the poster session portion, which is the one that comes after this one. You'll find that every poster session will have a unique and a specific Zoom link. Here in this tab, you also will find the convenience to download the symposium program with the abstract information of the different posters today. You also will have the e-poster gallery, and the poster gallery will give you the convenience to kind of give a quick look to those posters you are going to be listening from in the different poster sessions. So if you are curious to look some of them, I invite you to go and click to any of the sessions. And then here, they are going to take you to those posters. And as a reminder, if you want to go to a specific poster, just click on this link that will take you to the session. And then if you are looking for the specific poster, in this case, C4, that would be the breakout room that you're going to find the presenter for that poster. Now, I would like to introduce our university president, Dr. Kaufman, who will be delivering the welcoming for the symposium. Dr. Kaufman, the time is yours.
Thank you, Claudia. And it is indeed my great pleasure to welcome all of the attendees to our 7th annual research symposium. I mean, how exciting is this? This is the 7th year, obviously, that we have been running our research symposium. And it's been exciting for me to be here through those 7 years and see how much it's expanded and grown, how the breadth and depth of the research that's being presented has just exploded in those 7 years, and how we have expanded the amount of partners and collaborators that have made submissions to today's research symposium. So, all of the different universities across the United States and internationally, international researchers, and running from our first couple of high school presentations this year, presentations from high schoolers who have done research all the way up to graduate schools throughout the world. So it's really exciting for me to see how much things have expanded in the last 7 years. It is a great day to celebrate all of the research and all of the work that our students, faculty, staff, researchers have been doing over the past years to months, and to see the culmination of that work in a poster and podium presentation. So it represents our continued growth as a university in enhancing our research mission in addition to our education and service mission. So it's exciting to see everything that is on tap for today's symposium. I certainly want to extend my thanks also to Dr. Clark and Dr. Freitas for being the individuals who really were instrumental in getting this off the ground. Certainly want to recognize also our VP for Research and Dean of our new College of Graduate Studies, Dr. Jeff Talbot. This really has been his brainchild and his baby since the very beginning. I can't say enough about Jeff and the work that he's done to bring this to fruition, even through COVID and our first virtual research symposium. I'm kind of I'll show my bias here and say that I'm kind of hoping it's our last virtual research symposium, because there's something really nice about being able to walk around and see everybody's work and see all the posters. But on the other hand, it has offered us an advantage of being able to simultaneously have this symposium on both our campuses in Henderson and in South Jordan. So that's an upside, I guess. But with that, I'm going to conclude my remarks. Again, thank you all for attending, and I hope you enjoy and are able to attend as many of the breakout rooms and sessions that you possibly can. So again, thank you, and we'll turn it over to whoever's next.
Thank you, Dr. Kaufman. We are really excited for the symposium today as well. I will now turn the time to Dr. Clark, who is the other co-chair for the symposium. Dr. Clark.
Thank you, Dr. Freitas, and thank you, Dr. Kaufman. We're so eager to welcome our student podium presenters and learn more about the research that they've done over this past year. Each of our presenters will have 7 minutes for their presentation, followed by a 3-minute question and answer session. If you have any questions for the presenters, please feel free to use the Q&A box at the bottom of the webinar screen. The questions will be answered following their presentation. Without further ado, we would like to introduce our first podium presenter. Lindsay Roberts is from Roseman University College of Pharmacy, and she is going to be presenting on the impact of a Medicare call center during a pandemic. Lindsay, I'm going to turn it over to you.
Okay, thank you, Dr. Clark. So my name is Lindsay Roberts. I'm a P2 student at the Roseman University Henderson campus. I am going to be presenting on the impact of a Medicare call center during a pandemic. My co-authors are Cassandra Lytle, who's also a P2 student at Roseman University of Henderson, and Dr. Michelle Hahn and Dr. Leanna Oswald. Dr. Leanna Oswald was among the first to implement the Medicare call center back in 2015, and Dr. Michelle Hahn was one of the first volunteers to take part in the Medicare call center upon its implementation. This is also an encore poster presentation from the ASCP 2020 annual conference, where we presented this initially. A little bit of background on the Medicare call center on the Henderson campus. It's a student-led call center that is ran by ASCP, or American Society of Consultant Pharmacists, which is a student chapter club that is on the Henderson campus. And they certify counselors to advise people on Medicare. So we have volunteer students take part in the call center on their off time, generally on the weekends. And they are certified in Medicare counseling and are able to provide unbiased counseling to beneficiaries regarding overview of Medicare, information on Medicare Advantage plans, application assistance, and further counseling on state and federal subsidy programs, as well as local resources in their area. This is a partnership with the Nevada Medicare Assistance Program, or MAP. And the purpose of our study is to compare the differences between a COVID-19 pandemic year and a non-COVID-19 pandemic year. So we compared the number of beneficiaries we were able to serve in our Medicare call center during the months of March to September of 2020 and compared that to non-pandemic year in 2018. Our secondary outcomes were to compare the number of volunteers that we were able to have in the call center during that time, as well as the number of hours they were able to contribute. And we also looked at the total cost savings that was calculated for our beneficiaries during our calls. Overall, our main purpose was to see if we could maintain our productivity and efficacy during a COVID-19 pandemic, even regarding the restrictions that were placed upon us. Our data was collected from 2018 and 2020 STARS reports. STARS is a national tracking registry that MAP uses to catalog all the calls done, both at the remote Roseman call center, as well as the main MAP offices. We also used ASCP's volunteer tracking system, which gives us a look at volunteer hours, call information, as well as total cost savings. Cost savings is calculated based on what the beneficiary pays out of pocket for their Medicare and healthcare costs before speaking to one of our counselors. after their counseling session and they're advised on subsidy programs and other discounts they may be eligible for, we then take a look at what their potential cost savings is after getting those programs, and that's pending the approval in those programs. And then the volunteers also, we also analyze this using descriptive statistics, and the volunteers are the ones that put that cost savings together that we can use for data entry. As for results, we looked at the number of volunteers, which happened to be equal between 2018 and 2020. We had 11 volunteers in both categories. And the number of beneficiaries that served in 2020 increased in comparison to 2018, about 38.6%. That's shown in the bottom left-hand, that is shown in the bottom left-hand graph shows the number of beneficiaries served. The next category that we looked at were the number of hours that were able to be contributed by our volunteers. That also increased from 2018 and 2020. It increased about 81%. And then the total estimated annual cost savings that we calculated, it increased about 93% from 2018 in comparison to 2020. So in conclusion, we were able to serve our beneficiaries in the Medicare call center despite COVID restrictions. We were able to not only maintain effectiveness during the pandemic shutdown, but also increase our numbers when compared to previous years that lacked the COVID-19 restrictions. This just goes to show that successful partnerships between the College of Pharmacies and state-ran senior care services really gives the opportunity for professional pharmacy students to serve their beneficiaries and provide services that they otherwise wouldn't have been able to do. As far as ASCP goes, our goal for the Medicare call center is to further include other services to increase our community outreach. One thing that we've implemented recently is the medication therapy management service that we offer to our beneficiaries. This screens through the calls that we do in the call center, and eligible and interested beneficiaries are offered an appointment with our on-campus pharmacist, Dr. Kaylin Bowman. And this is a partnership we have with Dignity Health. If they're interested, they get an appointment and Dr. Kaylin Bowman reviews their medications, reviews their disease states, and further better explains adherence and things like that to the patient to give them a better understanding of their medications and also cost effectiveness of those medications. Once COVID-19 restrictions are lifted, our goal is to further increase our community outreach and go back to doing in-person health fairs where we were able to do Medicare counseling in person and reach a population that we otherwise would not have talked to possibly because all of our conversations are on the phone right now. I want to thank you all for coming and listening to my presentation. At this point, I'd like to open it up for any questions you may have.
Thank you so much, Lindsay, for your presentation. We have one question from the audience. Was there a difference in dollars saved per hour spent by volunteers?
So let me think about that. Dollars saved per hour spent. So that was not a piece of data we specifically looked at. The number of hours contributed, we looked at being that it went up because the quality of volunteers, they were willing to spend more time on calls, which is what raised our cost savings. So while our hours went up, so did our cost savings. And so the correlation there is where we wanted to point out.
We have another question from the audience. Did you do any statistical analysis on the differences between number of patients, hours, and costs? And was the difference significant?
We did not do any statistical analysis of that comparison.
Another question is, was there a difference in the volume of calls between 2018 and 2020? If there were more calls in 2020, it would show a greater need.
Right. So we did have an increased number of calls based on beneficiaries served. we get calls delivered to us from the main MAP office. So as many calls as they send us is the amount of calls we wish to receive or we try to complete. I'm not 100% sure on how many calls they received personally, but at Roseman, the need did go up in 2020 based on the number of beneficiaries served.
Another question says, how did you calculate estimated cost savings?
Yeah, that's a good question. So estimated cost savings, we take what the beneficiary is spending based on what they tell us, how they are spending on their Medicare and their healthcare needs. And we look at the subsidy programs they're eligible for. So something like extra help. We look at how much which is a prescription drug assistance program. We look at how much they were spending on prescriptions before being counseled on extra help. And if they're eligible, we take those discounts, whatever would apply, and we apply that to potential cost savings. And that's all pending the approval of the beneficiary getting approved into those programs. But that is a potential cost savings based on our counseling and what they're eligible for based on our screening.
Great. Thank you so much, Lindsay. If we don't have any other questions, we're going to go ahead and move on to our next podium presenter. So next we are going to have Sharon Sue, who's from Roseman University College of Dental Medicine, and she is going to be presenting on comparing the oral health of men and women.
Thank you, Dr. Clark. Hi, everyone. My name is Sharon Sue, and I am a second-year dental student at the Roseman University South Jordan campus. And the study that I will be presenting today is titled Comparing Oral Health Behaviors of Men and Women. My co-authors include Dr. Lipsky, Dr. LeCarey, and Dr. Hung. I'd first like to thank the Roseman University College of Dental Medicine Clinical Outcomes Research and Education for the support of this study. To start off with some background, oral health is important to one's overall health and well-being. It affects your general health, including pain, difficulty eating, etc., and also directly links to systemic diseases, which can complicate systemic disease treatment. Oral health is also known to affect your well-being. For example, the loss of self-esteem is associated with loss of teeth and untreated disease. Many studies on perceptions, attitudes, and opinions about oral health exist between sexes, and studies on social impact of oral health attitudes also exist. However, not much has been explored regarding specific oral health behaviors between men and women in the United States. So the purpose of this study was to identify and compare factors related to men and women's oral health conditions. Our methods included data from the National Health and Nutrition Examination Survey of 2017 to 2018, and our variables included demographics, oral health behaviors, and oral health examinations. Our statistical approach consisted of chi-squared test used to examine the relationship between sex and oral health variables, with the p-value set to less than 0.05. Here are the results of our study. In terms of demographics, we had a total of 9,254 participants. 49.2% were male and 50.8% were female, with the following racial distributions. There was an average age of 34.3 years old, and 49.2% of our participants were married, with the following marital status distribution. 56% of our participants had some college or above, with the following education level distribution, and 22.2% of the participants reported an annual household income of $25,000 to $45,000, with 19.4% reporting $100,000 or above. With regards to oral health behaviors, when asked about their last visit to the dentist, there is a significant difference between males and females in that females more often visited the dentist. In terms of their reason for the visit, there was also a significant difference in that females were more likely to go in on their own for a checkup, exam, or cleaning. When asked in the last 12 months if there was a time when they needed dental care but could not get it at the time, there was no significant difference between males and females. Here are the possible reasons as to why they could not get dental care at the time needed. Furthermore, when asked in the last year if they had experienced any painful aching, there was a significant difference in that females had more mouth pain than males. When asked if they had ever been self-conscious or embarrassed because of their teeth, there was also a significant difference in that females were more often self-conscious. There was also a significant difference when asked to rate the health of their teeth and gums. Males rated it more poorly. And there was a significant difference when asked if they thought that they might have gum disease, and that males thought that they might have gum disease more than females. When asked if they had had a direct conversation about the importance of oral cancer screening, there was a significant difference in that females were less likely to have had a conversation. However, when asked specifically about oral health screening, males were screened less. There was no significant difference when asked about whether or not they had a deep cleaning or regarding bone loss. Furthermore, when asked about their flossing habits, there was a significant difference between sexes in that females flossed more often than males. With regards to their dental examination, there was no significant difference in the presence of implants. However, there was a significant difference in the restored surface found on tooth number 3, in that females more often had a restored surface. Males also significantly had more root caries. And when given the overall recommendation for care, there was a significant difference in that females were recommended more to continue with their routine care, while males were asked to see the dentist at their earliest convenience. Our results show that men visited the dentist less, rated their overall oral health more poorly, were more likely to believe that they had gum problems or disease, were more likely to be told of the importance of oral cancer screening but were screened less, had more root caries, and were more likely to be recommended to see the dentist immediately. Past studies have shown that men with poor oral health experienced a higher risk of premature death. Socioeconomic and behavioral factors explain 52% and 44% of mortality risks attributed to poor oral health and being edentulous. Furthermore, oral cancer screening can reduce the risk of morbidity in high-risk patients. And therefore, it is important to educate men on oral health and to motivate our male patients. In terms of women, our studies found that women visited the dentist more often than men and on their own, flossed more regularly, cared more about the appearance of their teeth and mouth, experienced more aching, and were told less frequently about the importance of oral cancer screening, but of those that were women were screened more. Previous studies have shown that women perceived oral health conditions as having a greater impact on their quality of life and causing them more pain than men. Oral health knowledge was also significantly higher in women, and our results can confirm both these statements. Thus, women's knowledge and concern with their oral health have positive effects on oral health habits and dental visits. There are several limitations to our study. First, the data was self-reported and subjected to recall bias. Second, the data was subjected to variations in provider skills and instrument accuracy and sensitivity. And finally, the study did not include all gender identifications, and thus future research to include transgender and cisgenders can provide a more holistic overview. In conclusion, past studies have evaluated psychosocial opinions about oral health between sexes and correlations between oral health and overall health. The results of this study can give insight into differences in specific oral health behaviors and aid in the supporting past research on these perceptions. Overall, sex differences exist in oral health, and these differences can help us better understand preferences in oral health needs and differences in behaviors. The results of this study can also inform educational and interventional efforts to improve oral health outcomes and reduce disparities. And finally, future research on motivations for different oral health behaviors can help direct conversations with patients for more positive oral health outcomes. Thank you very much for your attention.
Thank you so much, Sharon, for your presentation. We'd now like to open it up to the audience for any questions for Sharon. So Sharon, our first question from the audience is, are there any impact of age or educational level?
Sure, I'm sure there are. We didn't specifically look at age or education level. We just simply looked at the difference between the genders. So I'm sure that age and educational level does have an impact on an individual's oral health behavior, specifically if they had more dental knowledge or if they were at an age where they could access dental care more easy. For example, if you were in a household that you were married or you had a family, that could be different compared to someone who is living alone. So yeah, I definitely think there are certain implications of age and education level, but those were not specifically studied in this one.
Thank you, Sharon. I have another question for you. It says, can you go back to how many of these participants were married or not? That's one part of the question. It says, is there any way you could tell if patients were married to each other? Example, if the wife schedules an appointment to the dentist, you would think the husband would also go.
Sure, yeah. So in our study, I believe there was around 49.2% or so that were married. The data is reported via each household. So with regards to specific individuals reporting more than once, I'm not 100% sure based off of the NHANES data that we used, but that's definitely something that we can look further into.
And the same question also asks if the patients have dental insurance.
That was not reported, so we did not look at whether or not they were insured or not, or whatever coverage that they might have had. But I'm sure that their dental coverage does play a part into how often they visit the dentist and things like that.
Sharon, our next question is there any impact that cost may have had on someone getting dental care?
Yeah, so I do think that cost could be a barrier to getting dental care. In this study, we specifically looked at the difference in access to care for males and females, as one of the results showed. And it did show that there was no significant difference between males and females in getting access to dental care when they needed it. So that wasn't a significant factor for our study. However, if we did specifically look at costs, that might be a factor.
And our last question that we have is, in an earlier slide, you listed the possible whys that women have better oral health. Can you discuss a few of those whys?
Sure. So those we just looked up on via literature reviews and data that's already out for us. And our study did support some of these perceptions. And that included that there might be lifestyle differences between the sexes. For example, their occupation or whether they were employed or not and who they live with, that can play a part into an individual's behavior. And then as well as oral health education, past studies have shown that women did have more oral health knowledge compared to males. That could just be due to the source that they receive the oral health knowledge. One study showed that the primary source are dental offices. So if women were found to go to dental offices more, they might have more dental knowledge and things like that. Also, women thought that oral health does have more impact on their quality of life. So that might opt them to go to the dentist more frequently than males. I hope that answered that question.
Great, thank you so much, Sharon. I would now like to introduce our final podium presenter, who is Tyler Jensen, and he's from Brigham Young University, College of Life Sciences. He will be presenting on acute e-cig vapor, or SHS, exposure induces inflammatory signaling in the adult murine lung.
All right, thank you so much, Dr. Clark. Hello, everybody, and good afternoon. My name is Tyler Jensen, and first off, just like to thank Roseman so much for having me here to present some research that we've done on inflammatory signaling in the mice lung. So today specifically, we're going to be looking at inflammatory signaling in response to e-cigarette vapor and secondhand smoke vapor. So the reason we were interested in looking into these pathways is because smoking and e-cigarettes are so prevalent in society. So there's an estimated 1 billion smokers globally. And with that many smokers, there's around 1.5 billion people being exposed to secondhand smoke. And it's estimated that over 500 million of those being exposed to secondhand smoke are children. E-cigarettes also are becoming more and more popular. There's an estimated 35 million users globally, and popularity is only growing. From 2011 to 2015, there was a 900% increase in e-cigarette use among US teens. So clearly this is becoming more and more popular, and there's a large need to understand what these vapors are doing to our bodies, and specifically what they're doing to our lungs. So to a degree, we do know what cigarette smoke does in the lung. We know cigarette smoke is known to cause cytotoxicity inflammation, and the production of reactive oxygen species. These effects lead to the development of chronic obstructive pulmonary disease, or COPD, as well as lung cancer. We do know e-cigarettes can also cause lung injury. As of last February, there was a total of 2,807 hospitalized cases of e-cigarette related lung injury. And some of these cases actually resulted in death. So in order to understand what's in these vapors and what they're doing, the pathway that we looked at was the RAGE pathway. Now, RAGE stands for Receptors for Advanced Glycation End Products. RAGE is a pattern recognition receptor, which means that it can be activated by various ligands. And these receptors are mainly expressed in alveolar type 1 cells in the lung. These receptors activate the NF-kappa beta pathway, which is known to be involved in inflammatory response, cellular growth, and apoptosis. These receptors therefore make a good target for prevention or reduction of chronic inflammation in the lung. So our objective in this study was to examine the effects of acute exposure to e-cig vapor compared to secondhand smoke in the mice lung. So now to our methods. So in order to do this, we had 4 groups of mice. One group exposed to secondhand smoke, and then 2 groups exposed to different flavors of e-cigarettes. We had a cinnamon and an apple group. And then we also had a room air control group. So these groups were exposed to vapors for 4 days for 30 minutes per day, and we used a nose-only exposure system. After the exposures, we collected bronchoalveolar lavage fluid, or BALF, and that was collected for cytokine analysis to look at infiltration. The left lung lobe we inflated for immunohistochemistry, and the right lung lobe we snap froze for later protein analysis. So now to our results. So first, using H&E staining, we observed that there were no changes really in cell morphology. We did some additional stains that aren't included here to measure if there were changes in cell populations, and I'll just briefly describe those. So the first cell population was SPC, and these show up in alveolar type 2 cells, which is a surfactant producing cell. We also looked at CCSP, which is a marker of cell health, as well as FOXA2, which shows cell populations that are required for alveolarization and that regulate airway epithelium in the lung. And in all of these cell populations, we did not see any changes. So next, let's look at our Western blot analysis of RAGE and its signaling intermediates. Analysis of NRAGE, which is known to be expressed in the nucleus and membrane, showed increased expression in the apple and secondhand smoke groups. Next, analysis of nuclear NF-kappa beta proteins showed only significantly different levels in the secondhand smoke group. Finally, analysis of p-ERK, which is a protein that is involved in cell proliferation, cell differentiation, and cell survival, showed significantly lower levels in the room air group, lower than the room air group in all 3 treatment groups. And this suggests that the cells are being placed under stress. So now to analyze our cytokine elaboration results. So the first cytokine was interleukin-1 beta. And interleukin-1 beta is a pro-inflammatory cytokine essential to host response. And we see that it is significantly increased in the green apple and secondhand smoke groups only. Next, we have interleukin-2, which is a cytokine signaling molecule that regulates the activities of white blood cells. And we see it was significantly increased in the red hot and secondhand smoke groups only. Third, we have interleukin-17A, which is a pro-inflammatory cytokine produced by T cells, and that is regulated by NF-kappa beta. And this one, we see that only the green apple is significantly different from the control groups. And then last, we have TNF-alpha, and TNF-alpha is an inflammatory cytokine that is produced by macrophages. And we see significantly increased expression in the red hot and secondhand smoke groups only. So looking at these results, we can clearly see that flavoring has something to do with elaboration. However, we're unsure exactly as to what that correlation is, but we do see increased cytokine expression with a lot of the flavors. So now, in conclusion, we can clearly see that inflammatory signaling is active following an acute 4-day exposure to secondhand smoke or to e-cigarette vapor. So such signaling in e-cigarette exposed mice has the potential, if we were to do a longer exposure, to lead to chronic inflammatory disease characteristics that could potentially mirror chronic obstructive disorders that are caused by tobacco smoke exposures. So in the future, we hope to do just that, do some long-term treatments and see if we observe pulmonary remodeling and disease characteristics. And then we also hope to identify targets in the RAGE pathway that might be able to attenuate the effects of those exposures. So just like to end now and acknowledge Dr. Paul Reynolds and Dr. Juan Arroyo, as well as all the undergraduate lab members at BYU that put in so much time and work into this research. And thank you so much. I can take any questions now.
Thank you so much, Tyler, for your presentation. We have a question here from the audience. Based on cytokine level differences, do you think that the metabolic pathways for possible chronic inflammation may be different for different products?
I would say we can't know for sure, but based on that we see different levels of cytokines for different flavors, I would imagine that that is probably true, but not 100% sure. But we do see different cytokine levels for the different flavors. So that suggests that, you know, they are taking different pathways. So yeah.
Do you know if the cytokines tested are involved in the RAGE pathway, or are they just common inflammatory cytokines?
A great question. So we chose those cytokines specifically because they are known to be associated with the RAGE pathway. So that's why we chose those and analyzed those, because they've previously been shown to be correlated with RAGE.
Next question is, does your group hope to use this research to influence a reduction in sales of these products? And there's a second part to this, so I'll have you answer that part first.
Well, I think a great question. I think our main goal is just to, you know, understand better what the e-cigarette vapors are doing, and if they're detrimental, you know, to help people out to avoid those COPD-like symptoms if we see those in the long-term exposures.
The second part was, does your research indicate if users of these products are at greater risk for COVID mortality or risks?
I'm not sure. We see inflammatory pathways activated, but I'm not sure how that would correlate with COVID. But that's a very interesting question, for sure.
Next question is, why did you choose to use this particular e-cigarette type? Is this the most popular e-cigarette that is used among the population? And are there differences among the designs and types that may cause differences in the way the vapor is released?
Great question. So yeah, we just chose some that seemed like they were good popular flavors. And I'm sure that there are differences in the e-cigarette method of releasing the vapors that would affect that. So that would be an interesting study to do for sure, and see, you know, what methods of release could affect the different inflammatory pathways.
Next question is, do you observe depletion of alveolar macrophages in the treated groups? And do you plan to look into macrophage polarization?
Great question. We didn't look into the macrophage levels, but that would be an interesting thing to look into, considering some of those cytokines are released by the macrophages. But no, we didn't look at the macrophage levels.
Great. Thank you so much, Tyler, for your presentation. We want to say thank you to each one of our podium presenters. You all did such an amazing job, and it was so great to hear more about the work that you've done over this past year. We would now like to invite everyone to visit our poster sessions. As a reminder, each session has a specific Zoom link, and each poster presenter will have their own breakout room within their sessions. I would like to share my screen with you and show you the program that Dr. Freitas had pointed to on the website previously. So here in the program, you will find that the different poster presentations are broken down. The abstracts are here by basic sciences, clinical, public health, scholarship of teaching and learning, and others. The basic sciences and clinical will each have their own Zoom link, and the public health, scholarship of teaching of learning, and others will all be incorporated into one Zoom link. If you scroll down there by different categories, here's the Zoom link as well provided inside of the program. And the abstracts for that category are below. Next to the title of the abstract, you'll see a number. So here is B1. That will be the breakout room that you will find for this poster presenter inside the Basic Sciences Zoom session. So we would like to encourage you to go ahead and go visit those poster sessions, and then we will come back for our closing session at 4 p.m. Pacific time, 5 p.m. Mountain time, to hear from our keynote speaker and to deliver our awards. So we'll see you at 4 p.m. Pacific or 5 p.m. Mountain time.